All right, hi everyone, it's Katie Wiskar from BBC. I am POCUS again. This is another pathology video, this time focusing on the kidneys, bladder, and examples of hydronephrosis. Again, as a reminder, these short videos are intended to give you some examples of what pathology looks like, as we often learn these techniques scanning normals, so that you can recognize it when you see it in your patients. This first one here, we just have a normal kidney, a normal hepatorenal interface, no evidence of free fluid. There is free fluid obviously in the lung above the diaphragm here, but the abdominal structures here appear normal. We note that when we're looking at the kidney, we see that bright echogenic inner medulla and then the darker, more isoechoic or hypoechoic renal cortex that is normal. This would be an example of what we call moderate hydronephrosis. So we see renal cortex, again, looking isoechoic, a little bit hypoechoic, a little bit dark. Normally, the inner part of the kidney, the medulla, should be bright, and we might see a small area of black or fluid in the renal pelvis that can be the blood vessels, so the renal veins and arteries in the renal pelvis. But when we see larger areas of black like this, that's suggestive that this is actually fluid and the renal pelvis is dilated, and we actually have hydronephrosis and urine that's backed up into the collecting system. We can grade hydronephrosis on the basis of how abnormal it looks. So mild hydronephrosis, we say, and we'll see some examples of this, is just dilation of the renal pelvis itself. So there's a larger black area within the renal pelvis. Moderate hydronephrosis, we see that black area extend into the pyramids, as we're seeing here. So it kind of looks like these fat fingers extending in the renal pelvis into the pyramids. And then severe hydronephrosis, we actually see effacement of the cortex. And we'll see examples of this throughout this video. This is a bladder. So this is a super easy technique that I highly encourage you guys to practice. It can be really useful in your patients looking for post-renal AKIs or thinking about urinary retention. So you're using the curvilinear probe. We're in a transverse view right now. So we've got the probe right down kind of by the pubic bone. We're fanning down towards the feet and then back up again. And we're seeing the bladder in transverse here. You can see also there is a large prostate coming into view at the end of this video, which could probably explain why there's a distended bladder and urinary retention here. And I've put the formula here for calculating bladder volume. You need two views to do this. So you would take width and depth in this transverse view, and then you do a long axis view to get height. I've put this here. I don't actually find this that practical to do, so I don't do this on a regular basis. I find it more useful to just eyeball and say, there is a tiny bit of urine in the bladder, or this is a very full bladder, because usually calculating the exact amount of urine in the bladder isn't making a clinical difference for me. This is an example. So here's a kidney, and this is what a renal cyst might look like. So that's your biggest differential diagnosis for when you see areas of black around a kidney, is that it's not actually hydronephrosis and it may be a cyst. And it sometimes can be hard to tell the difference. Here it's relatively clear because this cyst is cortical, and most renal cysts are cortical. So they arise from the renal cortex, not the inner medulla and the renal pelvis. So you can see that this kind of black circle is sitting in the cortex there. And sometimes patients can have more than one cyst, and it can look a bit like hydronephrosis. And the trick is that you want to fan through the kidney and see if those areas of black all connect together and come together in the renal pelvis. If they don't, then it's probably just multiple cysts. Here, for example, is a clip showing mild hydronephrosis. So it's a little bit more grainy, but you can appreciate this is a kidney. We see renal cortex. We see the bright medulla here. And then where the renal pelvis should be, there's just a bit more fullness than we would expect. There's a bit more black. And you can see that that black kind of extends with little fingers kind of up through the medulla. So this would be a dilated renal pelvis, and we would call this mild hydronephrosis. Okay, this is a good example to show because this is normal. So this is a normal kidney. You'll notice that there is more black than maybe we're expecting to see in a kidney. And sometimes we just have better visualization of the medullary pyramids. Those are those dark anechoic areas that we see kind of going into the cortex. That's just normal anatomy. That's a normal part of the kidney. So we know that this is not hydronephrosis because if we look at those dark anechoic areas, they don't all join together in the middle of the kidney in the renal pelvis with a dilated renal pelvis. And they're not kind of encapsulated enough to be considered to be cysts. And really that's where we expect the pyramids to be. So this again is an important example of something that's normal that sometimes you'll see in people who just have really good, clear sonoanatomy. This is another normal finding that's important to show. So sometimes, especially in young patients or thin patients, you may think you're seeing a dilated renal pelvis. So there'll be a larger than expected kind of anechoic area in the renal pelvis. And you'll think, oh, maybe this is a dilated pelvis and a dilated collecting system. Always really important to throw some color on it. So here we're using color Doppler because sometimes, especially in young patients, what we're actually seeing is just prominent renal vessels. It's not actually a collecting system that's dilated. It's not actually urine in there. It's just blood vessels and it's normal. So you would put your color box on kind of the renal pelvis. And if it all lights up with color, then it's all just blood vessels. It's normal. If it does not light up with color, then you're looking at probably mild hydronephrosis. Here again is a bladder. This is just a still image showing you a bladder with an enlarged prostate down there. Again, I put the formula here, but I would not necessarily say this is important to do. You can play around with it. But finding the fluid in the bladder, identifying an enlarged prostate, which sometimes is just really obvious when it's very impressive, is definitely useful. This is an example of hydronephrosis, probably moderate at least, looking at this clip. So we see a kidney here. And as we fan through the kidney, so again, it's important, especially when we're looking for hydronephrosis, to use that gentle fanning because we need to survey the whole kidney. We need to see if the structures connect to each other, these anechoic areas, if they actually connect and come together. So that's why fanning is really important when we're doing this. We see that these black anechoic areas come together in the middle of the kidney, in the renal pelvis. They all join together and there's that dilated renal pelvis and then it leads off into a dilated ureter that we stop being able to follow. So this is probably moderate hydronephrosis. We've seen this clip before in a previous video. This is just an example of polycystic kidney disease as well as some ascites there in the near screen. The point to make here as we're talking about kidneys is just that polycystic disease can really distort the normal architecture of the kidneys. In really severe disease, it can become very hard to tell that you're even looking at a kidney because it just all looks like cysts. It all looks like these encapsulated anechoic areas, but this is what this can look like. This is a bladder volume now in long axis. So we've seen a couple bladders in short axis, in transverse. We now are scanning with our curvilinear probe in long axis, so the indicator pointing up towards the patient's head. We see some bowel over there on screen left. On screen right, we actually see some bright and then shadowing, and that's because we've run into pubic bone, which is normal. And then that anechoic area in the middle is bladder. So if we were going to try to do the volume, we would do the height in this view, times it by our width and our depth, and then our coefficient there to get a bladder volume. This is another example of hydronephrosis paired with a clip that we saw earlier. So again, this is probably moderate hydronephrosis because we definitely see a dilated renal pelvis leading off into a bit of dilated ureter on the right side of our screen. And we see that those kind of fat black fingers extend kind of into the pyramids there. So I would probably call this moderate. And really the distinction between mild, moderate clinically is insignificant, right? If there's hydronephrosis, then something is probably wrong. And probably if you see this on POCUS, what you're going to want to do is order an ultrasound, a formal ultrasound to follow this up. So not to worry if the distinction between mild and moderate isn't always clear. This is just another nice normal example of a normal kidney. We see liver there. We see hepatorenal interface. We see kidney with a nice kind of isoechoic, almost hypoechoic cortex. That's normal. We see some bright in the middle there. That's the normal medulla. And then we see a little bit of black within the renal pelvis. That's just normal blood vessels collecting there together. And if I wanted to be really sure of that, again, I would put some color over those black vessels to confirm that that is not a dilated renal pelvis and a dilated collecting system. This is another transverse bladder with some fluid there. Again, we're fanning through it. So keeping in the principle that in the abdomen and with stationary things, we are often fanning through to get a full extent of the organ. And we can see that there's obviously some fluid in this bladder. I wouldn't call this subjectively terribly dilated, but there's obviously some fluid here. This is another example of polycystic kidney disease, a little bit of a grainier image. We've got some liver there kind of on the top left of our screen. And then the normal kidney architecture becomes difficult to see. We see kind of one larger cyst and then several sort of smaller cysts off on our screen. So this would be another example of polycystic kidney disease, not quite as dramatic as the ones we've seen before. We note that these black anechoic areas don't seem to all join together, which is our clue that this is multiple cysts and not hydronephrosis with those anechoic areas all joining together. This is really severe hydro. So this can look somewhat like severe polycystic kidney disease and be a little bit hard to tell what even we're looking at, just because you end up losing so much of the normal kidney architecture that it's hard to see any sort of renal cortex. But again, the key here is as we're fanning, we're trying to see that these black areas come together, which I think they do. We lose it a bit at the end of the clip. And we'd like to try to follow that all the way into the pelvis and ideally see a bit of the ureter leading off as well for us to truly confidently call this hydronephrosis. Here's another bladder with a prostate in it as we're fanning through, looking quite distended and fluid-filled. This is just a still of probably what we would call mild hydronephrosis. So we see renal cortex, and then we see kind of within the medulla, there's more black than we would expect, and we see the black areas kind of join together. So again, I would put color on this to make sure these aren't just prominent vessels, but if it did not light up, then I would say this is probably mild hydronephrosis with a mildly dilated renal pelvis. Another polycystic kidney disease. Again, you lose a lot of the normal architecture of the kidney, and kidneys can become very, very large, and the cysts can be very, very large. So you would want formal imaging if the patient hadn't had any to follow this up. But this is not hydro because they're not all joined together. And this is not ascites because it doesn't look like free fluid. It's not freely flowing. These are definitely encapsulated areas of black fluid. This is a fluid-filled bladder. And you see that little white thing that's kind of coming through a clip. That's a bit of the Foley catheter. So we can actually sometimes see the catheter itself and also the Foley balloon on ultrasound. And this can be a really useful technique for confirming that the Foley's in place, making sure the Foley's drained properly. If you see a dilated bladder with lots of urine within it and a Foley within it, and the patient's uncomfortable, then probably the Foley is blocked and needs to be flushed and or changed. So this can be very useful for helping to troubleshoot catheter problems in your patients. This again is an example. This time we're in a transverse view, and here we nicely see the Foley balloon. So sitting within the bladder, there's some urine within the bladder. We see this clear Foley balloon there. So if there was a lot of urine here around the Foley balloon, and there's a decent amount here, then I'd be worried that the catheter isn't properly draining the bladder. So we would try to flush it, maybe replace it. Again, a nice confirmation of placement here. This is on the left side. This is just a normal kidney. Again, to remind us what normal looks like, we see some spleen there on screen left. We see the splenorenal interface. And within the kidney, we see the brighter medulla and then the darker cortex with some of those kind of anechoic or hypoechoic renal pyramids there. That's normal. There's no dilated pelvis. There's no big black area in the middle. So this just looks like a normal kidney. This again is a relatively normal kidney. I would say perhaps a little bit echogenic. So again, sometimes we'll see in ultrasound reports that patients are reported as having bright echogenic kidneys consistent with medical renal disease. And we see that in, CKD, diabetic nephropathy, things that are long-standing. You get these really echogenic kidneys. The kidney here looks fairly bright. We usually compare it in echo texture to the liver, and the cortex here is looking a bit brighter than the liver. But certainly from a perspective of hydronephrosis, I don't see any dilated pelvis. I don't see any big black areas to make me worried about that. This is a really impressive example of an echogenic kidney. So again, we usually compare the echo texture to the next door liver or spleen. I think this is liver here, but though we're not labeled. And certainly the renal cortex, which is normally supposed to be quite hypoechoic and dark, looks very bright there. I also would wonder a little bit about a slightly dilated renal pelvis here. I would want to put some color on to see if those are vessels that I'm seeing, or to see if that might be a little bit of mild hydro. Okay, that's it. Hopefully these slides were useful. Check out, there's some more additional instructional videos on the website about how to actually scan these areas, in addition to these examples of pathology. Thanks.